Hey, my name is Carmel Hauck. My student number is T00701793. This is my pig stifle joint here. So I've got my femur, I've got my knee joint, and then I've got my attached tibia fibula as well. And I do have it sliced in half so that we can see the inside as well. Now our first term, I think I want to pick this one. Oh, and I forgot to mention, I did nickname her. This is Hermione Granger, if you're a Harry Potter fan. And my first term, I'm going to point out on our femur. So on the long bone here, our first term is the diaphysis. So the diaphysis is the central shaft portion of the bone. And then the epiphysis are the proximal and distal ends, where it kind of has the top and the bottom. So that is the epiphysis and the diaphysis and the epiphysis. And our next term is the epiphyseal plates. So those are areas on a long bone where the cartilage kind of remains and it separates the epiphysis and the diaphysis. So on our bone here, it's kind of this darker portion here is our epiphyseal plate. And then at the top, again, our epiphyseal plate that separates. So our compact bone or our cortex bone is the strong, dense bone on the outside layer of all bones. So this is compact bone, this is compact bone as well. Now our next term, I did struggle with a bit just because my bone is pretty fleshy, but the nutrient foramen, so those are pretty important because they are small foramens or openings into the bone shaft where nerves, blood vessels, lymph vessels kind of pass through and carry blood, lymph, etc. in or out of the bone marrow. So I'm gonna make my best guess just because I can't actually visualize one. Up in here is where my best bet at a nutrient foramen is. And it's just this little tiny hole underneath all this flesh and membrane that kind of goes in and out of the bones. And again, they're super tiny and it's pretty fleshy. So they're kind of located centrally though along that shaft. Ooh. So our next term is the medulla or the medullary cavity. So the medulla itself is kind of basically the innermost part of the bone. So the medulla to me is the bone marrow, or at least where it sits, and that's what it's made up of. And if you were to scoop out all of that and you're left with this hollow hole, that is what the medullary cavity is. And then the next term is cancellous bone. So cancellous bone is that light porous bone on here at the end of our long bones. We have cancellous bone. So it's spongy, it's filled with all these little spaces, and those little spaces have bone marrow inside them as well. The next term is periosteum. So periosteum is the membrane that covers the outer surfaces of the bone. So you can kind of peel it back a little bit. There's this membrane that coats the outside of my diaphysis here, and it just kind of coats it. And then the endosteum is kind of the opposite. So again, if I scooped out all this bone marrow, it would be the inner membrane that lines the hollow interior surface of the bone. So if you scoop out all that bone marrow, inside along there would be a similar membrane to the outside. Bone marrow, going back to, is our next term. So bone marrow is this kind of buttery fat substance inside. That is yellow bone marrow. It consists of fat or adipose tissue. And then there is also red bone marrow, which is most commonly found in young animals, but you can find it at the ends of some long bones as well in that cancellous bone. Our next term is joint capsule. And again, my knee joint is pretty flimsy at this point. Got a chunk on me. So it's a little bit hard to visualize that just because of how we got this, but this is essentially where our joint capsule is. It is the multi-layered surrounding of the joint cavity itself. So it includes the synovial membrane, which is like the inner lining of the joint capsule, the joint capsule itself. So this is kind of where I'm envisioning the synovial membrane to be, kind of holding all of this in and keeping it together. And the synovial membrane is what produces synovial fluid, which is kind of that lubrication inside and goes in between all these joints. So it kind of keeps it all in and keeps it contained so that the knee is kind of sitting in this pool of synovial fluid. Our next term is hyaline cartilage or articular cartilage. It is the most common type of cartilage, and articular cartilage is actually a type of hyaline cartilage. And so this is the thin lining on the joint surfaces. It covers the joint surfaces. So if we go in here, all through here, all through these joint surfaces inside would be articular cartilage. And it kind of helps reduce friction. It's tough. It helps the joints rub against each other all day, every day. Our next term is the meniscus. So those are two cartilage structures that pass medial and lateral. So which one do I like again? I'm going to go with this one. So meniscus, I'm imagining crossing through here. So it goes on both sides. And if we bring back both sides of my leg, we will be able to kind of picture a medial and a lateral meniscus. And they kind of cross through the back. And again, it's pretty fleshy in the back, so I was having a little bit of trouble visualizing it. But I'm picturing the meniscus to go back through here, this way and that way, holding the bone together, helping strengthening that knee joint. Our next term is medial and lateral condyles. So condyles are our articular surfaces. We can find them on the femur and the lower bones as well. So as far as our femur goes, and again, it's pretty fleshy still, so I maybe should have tried to scrape some off, but oh well. On our upper surface here on our femur, these are my condyles. So our condyles here are these outer projections. There are medial and lateral condyles. So I have a right hind leg. So if I'm looking at it, this is my cranial view. This would be my lateral condyle of my femur, and then my medial condyle of my femur on this side. Our next term is patella. So the patella is our kneecap. It is this right here that is split in half. So if I take half of him, you can see half of my patella right here dangling. It is the largest sesamoid bone in the body, and that's the kneecap essentially. And the trochlear groove is the groove in the femur bone underneath the patella. So if we move this femur a little aside and push that patella back, this in here is the trochlear groove. So in underneath on the femur, underneath the patella. And now I do need just a second to swap out my glove and scroll down my list of terms. So forgive me, I don't want to touch my laptop. All right. So to continue, we've got lateral and medial epicondyles. So epicondyles are projections off of the condyle itself. So if we're looking back here at our lateral condyle, up here is our lateral condyle. Our epicondyles are these upper, rougher portions of the bone that attach to the muscle. So there's the lateral epicondyle, and then over here our medial epicondyle as well. The next term is our tibial tuberosity. So I'm going to take half of it again. Our tibial tuberosity is the apex of the tibia. So it protrudes underneath the patella, and it's attached to the patellar tendon. So this is my patella, my kneecap here. This is my tibial tuberosity. And then this here is our next term, which is tibial crest. So the tibial crest is that ridge of bone that continues distally from the tibial tuberosity. And that is, again, patella, tibial tuberosity, tibial crest under here. I'm going to put it back together to show you the fibula. So what side of the tibia is it located? So the fibula is located lateral to the tibia. Again, I have a right leg. So this is my tibia and this is my fibula, the small bone here. So it is again lateral to my tibia because I have a right hind leg. Our next term is anterior and posterior cruciate ligaments. So these are two X-crossed ligaments that connect bone to bone. So I like this one better. So these are the X-crossed ligaments through here and here that connect femur to tibia and kind of help hold that knee joint together. The anterior or the cranial is the one that sits on top or in front. So that would be this one here. And then the posterior or the caudal is the one that sits behind. So that's that one underneath. And then we have the medial and lateral collateral ligaments as well. So I'm going to put it back together. And this one I had a little bit of difficulty visualizing as well, just because of all the flesh that I still have on the bones. But there's more ligaments essentially in the knee joint, and they're located laterally and medially on each side of the joint. providing further support and connecting the femur to fibula, femur to tibia as well. So they're along the sides of the knee joints on here and here basically. And the final term we have to point out is the patellar ligament. So again, we have our patellas, we have our kneecaps, and if we split them open, our patellar ligament is what holds the kneecap to the tibia. So it's the ligament that attaches the distal end of the patella to the proximal end of the tibia. So right in here would be our patella ligament right there. And next we're going to discuss the drawer test. So a veterinarian would, if she was doing a drawer test, essentially she would palpate the stifle to assess if there's any abnormal forward and back movement of the femur and tibia. So if we have our knee like this, essentially we shouldn't be able to move it forward and backward. So I shouldn't be able to go like this and move it. And I couldn't even with this pig leg joint that's cut in half. So clearly our cruciates are still intact. It's used when assessing for injury to see if those cruciate ligaments are injured or torn. The X shape of that ligament should prevent any movement. So if the drawer test is positive and there is movement, that means we'd have to assess for injury, rest, surgery, etc. We'd have to discuss kind of next options. But that's the drawer test, is they kind of do that anterior, posterior, forward, backward movement. And then that's leading to the difference between human and animal nomenclature. So the main difference that I found was the cranial and caudal cruciate ligaments, when in human medicine, like I just said, they use the anterior and posterior. So a CCL tear versus an ACL tear is my main difference. And I think that is the majority of what I have to do with this leg joint. So I'm going to go put them back in the freezer.